Hi, everyone. Dr. Funke Brown here. I am the founder of Restful Sleep MD, and I am also a pediatric pulmonologist and a sleep medicine physician. And I have a treat for you today. I have a guest here who is extraordinary. We are friends, we're colleagues, and I have the wonderful Dr. Caroline Okorie, who's also a pediatric pulmonologist and a sleep medicine physician. And so welcome, Dr. Okorie. How are you?
I'm well. Thank you for having me. Thank you.
And so could you introduce yourself to our guests?
Yeah, so a little bit about me. I am Dr. Caroline Okorie. I'm a pediatric pulmonologist and a sleep specialist. I happen to be at Stanford in California. So that means I see kids with breathing issues, respiratory issues, but as well, I see a lot of kids with all sorts of sleep issues as well. So that's a little bit about me.
Awesome. I know we were talking a little earlier about what morning is like, because right now it's about 12:30 in Philadelphia and it's about 9:30 in California. So what's your morning been like? How your week been like so far?
I was on pulmonary call last week. So I had a little bit of a busy week, which means I was seeing kids in the hospital, and then just had a busy clinic week. So my morning was a little bit late. I didn't wake up quite as early as I normally do, but that happens sometimes. So I knew that my body needed a little bit extra sleep. So I kind of slept in, just had my cup of coffee, and I'm here talking to you.
Love it. I love it. I love that you said that. Honestly, we are big on making recommendations about specific number of hours of sleep and all that. But in the real world, sometimes we may need to sleep in. Sometimes we may be short on sleep. The important thing is to continue to prioritize it, I would say.
Absolutely. Absolutely.
Yeah. So one of the questions I had for you, I mean, the field of pediatric pulmonary and sleep medicine is kind of small. And I have lots of friends and even my family saying, wait, okay, you're a sleep doctor, a pediatric sleep doctor. What's that? What's that again? What's it you do? Really? Kids have sleep issues, I get that all the time. People
Yeah.
just feel like, there's sleep training and then that's it. You sleep train your baby and then that's it. And then that's it. You just deal, right? And to think that we both have a career helping kids sleep, like that really comes surprising to a lot of people. So I just wanted to find out what drove you to sleep medicine. How did you find your way here doing what you're doing?
It's so interesting. As you know, as a pediatric pulmonologist, in pediatrics, oftentimes sleep issues come to the lung doctors because oftentimes it's related to breathing. So I think I had a little bit of an introduction to pediatric sleep issues as related to obstructive sleep apnea or kids with lung problems where they can't really breathe very well and that disrupts their sleep. So that's where I kind of got my first introduction. And I was lucky where one of my mentors was also pediatric pulmonary and sleep trained. And she gave this idea. She's like, you should go look into this. It's a really great field. And I was like, oh, I don't know. It's another year of training. I don't know. But I was lucky where I got to train with people who were kind of some of the pioneers in sleep. And so they had a lot of just like real passion about the field. And so I got to learn that sleep is not just about breathing. It is about routines, habits, that it's actually really multidisciplinary. My co-fellows were from pulmonary critical care, neurology, family medicine, internal medicine. I'm pediatric. So it was just kind of fun that we all kind of learned together and worked together. We could ask each other, hey, what would you do about this? And what is your perspective on that? And I thought that was fun. And then I think lastly, I also realized how transformative sleep is, right? Where, no matter what your primary issue, whether you're a patient who has a cardiac disease or lung disease or seizures, your sleep affects all of that. So I think I just love that sleep was multidisciplinary, it was transformative, and it kind of just improved your life overall. And I think sleep doctors are kind of a special group of people who care about prevention and transformation. And I don't know, I just feel like I'm like, oh, this is my crew. So that's kind of how it happened.
I love it. It's so funny. Our stories are just so similar. Where I started off as a pediatric pulmonologist, I'm gonna help kids breathe better, right? And then it's like, okay, what's going on with your sleep? Because that's the thing. If you have asthma and you're waking up frequently because you're coughing, your sleep is distorted. And the sleep of the entire family is distorted. And so, I came in thinking, okay, let's get an idea of the sleep related breathing issues. And then it was like a whole different world, right? I have psychiatrists too, right? Doing sleep and just how everything just really connects. And I often tell my patients, I'm like, it's still one body, even though someone says, okay, I'll take care of your heart, I'll take care of your stomach. Like it's one body, and so I really do love that. And I agree. I think it's been very fulfilling. And for me, honestly, like a lot of these things we didn't learn about in medical school. Maybe we had one course on fatigue and your duty hours. And so coming making sure that you don't exceed those duty hours, and it's like a check mark, and that's it.
Right. Yeah.
And so, the impact of sleep, understanding the science of sleep and the consequences of sleep deprivation, and how we can't just fold our hands. We have to do something about it. And being able to do that, I think, is being very fulfilling as a female, as a Black female. It's incredible. I think it's really been quite gratifying, right?
Oh, totally. I mean, I think you and I are probably used to often being one of the few or one of the only in most of the rooms kind of we find ourselves in, which, I'm kind of used to. But I will say, especially in a field like sleep medicine, that's relatively young, I feel, I really think I feel like I'm often really the only one in the room, or very few. So that's why when I met you, I was like, oh my gosh, another unicorn.
I love it.
I do think it's really important. I love learning from other people. And I think the fact that it's multidisciplinary, that it is a very diverse field in terms of you have physicians from all different parts of the world and the country. I love that. But I think my voice is one that I think was maybe lacking. So it's nice to have kind of my perspective as a Black woman, as a child of immigrants, just kind of to be able to speak to that and help people remember, like, well, there are actually some cultural differences in how people look at sleep and how they look at family time. And I think also it helps, like, if I see a patient who happens to look like me, first of all, they get excited if they happen to look like me. They weren't expecting it. But then I feel like we already know that when you have connection with your patient in a special way, you can actually reach people who maybe otherwise may not have been reached. So I feel like really grateful that I think I can talk to some of my teenagers in a different way than some of my colleagues can. And I think that helps me really make a difference.
That is, that is so true. And, when you bring that up as looking like some of our patients, I think it's really transformed first my approach, especially to like teenagers, or, especially for teenagers who maybe are on CPAP and things like that. And it's been years and nobody can get them to wear their devices and use their CPAP and all that. But we cannot connect in a different way, because it's like, listen, there's some things that may be priority to them now than other things. And really, I feel like that helps, bridge some of the communication difficulties that, most people may have encountered. So absolutely agree with that. What would you say are some of the lessons you've learned on your journey just so far, again, as a physician, a minority physician in Black in medicine who is practicing sleep medicine? What are some things and how has that evolved?
Oh, that's such a good question. Oh man, I'm trying to think of like how when I first started this, I'm very grateful and very lucky that my father is a physician. So I feel like I grew up around a doctor, around doctors. So I had a perspective of what medicine looked like. He happens to be emergency medicine. His job is very, it's very straightforward. He goes in, he saves people's lives. Like it's just very, very clear what he gets to do. And I think, other aspects of medicine, I think are a little bit more nuanced, I think, than I think I realized. And so I think I saw the importance of finding my niche within medicine. So I think, especially with so much more paperwork and all these things, I think I've realized, okay, well, I still need to find what makes me jump out of bed in the morning, and get really excited. So I think what I've kind of learned is that it's okay to pursue things that really make me excited, even if no one else is doing it, or even if other people think it's an odd thing to go into or an odd thing to explore. I think I've also learned that, again, as going through, I used to, feel a little weird having being the only one, or being having this different perspective. And now I realize, like, oh, actually, even if people in the moment are like, I don't really know what you're talking about, I think I think I've learned that eventually people actually do still hear me. So I think I'm less afraid of giving my opinion and giving my perspective, and trying to offer help to people. And so I think that's kind of, I think I've as one gets older too, you also have more self-confidence or self-reliance. And so I think that's kind of changed over time. And I think the other lesson that I've come to learn is that our patients really appreciate us to be human as well. I think, especially in, we learn about, oh, well, you're the doctor and they're the patient, and you are the one who looks over them and tells them what to do and makes things better. And I've learned, yes, that's part of it, right? They are coming to us for help. But I think, I think I have a lot of patients who can be very complex and have really sick kids, like I know that you see too. And, I've had a few moments where I cry with the parents, I'm like, this is sad, and I think parents have really come to appreciate, and it makes a deeper connection. So I think basically all that is to say, I think my view of being a doctor, I think, is just more nuanced than it was when I first started this journey. And I've also realized that there are so many different ways that anyone can take it. I mean, even though we have a lot of similarities, I'm sure our days look very different, just even in how we, approach patients, or, what we spend most of our time in. And I think that's all okay. And so I think that's one of the big things that I've learned.
That is so true. I think you are so right on point when it comes to, I don't know, I guess it's age and experience. You just sort of start to embrace authenticity even more. Like, you know what? I have a seat at the table too, and my voice can be heard. And I think that's just been incredible, this journey of self-discovery, and not necessarily putting ourselves in a box. There are ways that things can be done, and we can create new ways, and that is totally okay, right? I think that's been an incredible revelation for me over the last few years. And I love that that's the same experience you're having as well, right? So, okay, let's get to some more fun stuff, because again, people are always asking me, okay, kids have sleep apnea? I thought sleep apnea was in old men or whatever. And so tell me some sleep issues that you frequently encounter in your practice currently.
Yeah, I have to say, it's so funny. Yeah, it's so funny. If people always tell me too, they're like, what do you mean kids have sleep apnea? I'm like, oh, they do. It's actually, and the funny thing is, whenever I even see a kid in my clinic, because, it's also labeled as a pulmonary clinic, I always ask kids, do you know what kind of doctor I am? And half the time they're like, no. I'm like, I'm a doctor who helps kids sleep. And I'm like, did you even know that existed? And most of them were like, no, I didn't. So I laugh. Half the kids who come see me are like, I don't even know why I'm coming to see you. So I see the whole gamut. I think it's probably similar to you. So I see from the 10-month-old that the mom just wants to sleep train and get this kid to sleep for more than 4 hours at a time. And I love that. That's so much fun. So I see kids who just, sleep training. I see also kids who have really complex breathing issues and need to be essentially on a ventilator or a machine at night. So I see from that gamut. I also see kids who just really struggle with routine. So who, especially in this pandemic, I'm sure as you, I'm seeing a lot of kids are just really struggling to get back into a routine, back into a habit. And then a lot of teenagers who, as we know, teenagers have a natural circadian rhythm shift, right? They all kind of want to go to bed later, wake up later, but school still starts at a certain time. So there's that struggle. It causes a lot of tension in the family. So I feel like I deal with a lot of that. even to some complex neurologic issues like narcolepsy. I also deal with that as well. And a population I've really come to love is also my patients who are neuroatypical. So kids who have autism, ADHD, any, or developmental delay, intellectual disability, and who just really struggle with sleep in that population. So I think I really have a very a wide range of sleep issues I see in my clinic, which actually makes it really fun.
It does actually. And I think that's one of the things I enjoy the most as well. Like there's such a wide gamut of things that we can help fix in that sense, in terms of sleep issues, and there's, and how that interplays with so many aspects of their lives, like you mentioned, totally. Like with ADHD, autism, ADHD-like symptoms for kids who are not sleeping well, and how that relates. And there have been actually some kids, just similar, my practice is very similar to yours as well, where nobody knew these kids had developmental issues, right? Nobody knew. They just came in, and the only issue is sleeping difficulties. And all of a sudden, the family is living with a referral to see a developmental pediatrician. And it's incredible what we see and what we start to unravel as we start to dig deeper into their sleep and seeing how it impacts their day. And, I just think it's been so fascinating. And it's interesting that you have the same experience as well.
And I love that you said unravel, because I do, I always, every time I have like trainees sometimes work with me, and it's funny because, they'll look at the referral and they said, it just says sleep problem. And I'm like, yeah,
that's all you got.
That's what often my referrals say.
Something is wrong with their sleep.
Something's wrong with their sleep. So it's kind of, at first I used to be like, oh my gosh, like people need to be more specific. But I realized, I think a lot of times when doctors are referring to us, they're asking for help. They're like, I don't have time to unravel this, or, I just can't right now. Can you please help me unravel? So I feel like, I'm sure like as you, it's like this mystery or this puzzle I get to put together. So I think it's actually really, really fun. And as a specialist, I also get more time with the patients too. So I know a lot of people who are in primary care, they have to see patients every 15 minutes. And I think you and I are luckier that we actually get a little bit more time. So I actually can kind of dive in and ask, and even things that parents will say, oh, it's probably not relevant, but this fact. And I'm like, oh, that's incredibly relevant.
I know.
I'm like, let's dive into that. So I just love that you said unravel, because I feel like that's what I do every day with like new patients.
I know. It's so fun. So fun. So another fun question I have for you. So if you didn't do medicine, if you were not a physician, what would you have done instead as a profession?
It's so funny. I want to say I would be a musician or a rock star. That's what I want to say.
I love it. Let's dream.
That's like my dream. Like, oh, it'd be so amazing to be a rock star. I don't know that I have the talent to back that dream up, but I think what I'd actually probably would really do is write. I've always loved writing. I actually took a foray as an English major in college. I was still pre-med, but I really enjoyed writing. I enjoy reading. I love poetry. As a kid, my poor parents, my head was often buried in a book. Even when we were traveling and seeing all these great sites around the country, I was always just reading. So that is what I think I'd love to do. And honestly, I'm realizing again, as I get older, I'm like, wait a minute, I don't have to just be one thing. So I'm actually trying to think if I can get back into writing a little bit more. So
love it. I love it. I see a blog coming up in your near future, if that's the case. I would read.
Working on it. Yes.
I would devour your content. So yes. Looking forward to that. Well, this has been fun. So what final words do you have for us? And also, where can people find you?
Great. So I am I'm Stanford Children's Health in the Bay Area in California, in Palo Alto. I think my final words, it's probably kind of what you say too, is really just finding ways to prioritize sleep. That does not mean that you will get it perfect every night, or that you'll do it right each time. But I always just tell people, just like you prioritize water, food, brushing your teeth, I always tell people just try to prioritize sleep and do what you can to really optimize it, because we just know it helps your quality of life. It helps your mood. It's really can be transformative. So that's, if I could just sum it up, it's prioritize sleep.
That is awesome. You heard her, people. 2 sleep experts are telling you. So there's some truth in that. So definitely prioritize your sleep. It's so important. Well, this has been great. Thank you so, so much for hanging out with us here today. And
Thank you for having me.
we'll see you later.
Thank you. Bye.
Bye, everyone.